Anatomy for radial axis for angiography. Aortic arch gives off the great vessels. Innominate artery on the right, common carotid and subclavian arteries on the left. Axillary artery on the right gives to right brachial and right radial artery. On the lateral margin of first rib, there is transition from subclavian to axillary. On inferior border of teres major, axillary continues as brachial, and brachial artery bifurcates in most patients into radial and ulnar arteries below the elbow. Here is the diagram and angiographic image of the brachial artery dividing into radial and ulnar arteries. Some patients will have anatomic variants, and most common variant is the radial artery originating higher than the elbow. The various anatomic variants have been shown in the figure. In cubital crossover from A to F, G showing right radial artery angiogram showing conventional anatomy of the radial artery, H showing the right radial artery anastomosing to brachial artery in the cubital fossa. In I and J angiographic images, there is indication of radial artery loops. In K angiographic image, there is small radial artery continuing superiorly as brachioradialis after a small anastomosis to brachial artery in cubital fossa, indicated with arrowhead. And in the L angiographic image, the radial artery continues superiorly as brachioradialis artery without a discernible cubital crossover to the brachial artery. The radial artery will continue along the lateral aspect of the forearm into the wrist, where it passes over the scaphoid and trapezium bone and divides into two deep and superficial palmar arches. So these are the deep and superficial palmar arches on angiography. Caution should be to avoid cannulation of radial artery to distally. The figures showing optimal position of the hand and the cannulation catheter and as well as the right area to go for while cannulating the radial artery.